Good day, Ma'am and Sir. I am Bethel Gandikihal, a student nurse of Davao Doctors College. And today I am going to demonstrate to you perineal flushing. So perineal flushing involves cleaning the private areas of the patient, the perineum and the genitalia. So this is done for the purpose of removing perineal secretions and others, prevention of infection and contamination, and to promote client comfort. So perineal flushing is indicated for patients who are in labor and in postpartum, for patients who has a perineal repair, for comatose patients, bedridden patients, and for those who has an indwelling catheter. So now, prior to the conduct of the procedure, I have prepared the necessary equipment to be used to conserve time and energy. And also, I have performed hand washing to protect my patient and also myself from the infection and cross-contamination. So now I am going to introduce myself to my patient, verify my patient's identity, and explain the procedure to my patient to gain her consent and gain her full cooperation. Good morning, ma'am. I am Beth Wilgondikal, your student nurse for today. So, ma'am, may I see your wristband? So, ma'am, may you please state your name and your birthday? Okay, ma'am. So, today, ma'am, we'll be doing the perineal flushing. So, basically, I am going to wash your genital area so that you will feel more comfortable and refreshed. Will that be okay with you, ma'am? Okay, great. So before we begin, ma'am, I am just going to close the door so that no one from the outside will be able to disturb us while we're doing the perineal flushing. Okay, the door is closed to ensure patient's privacy. So after doing that, so place the patient in a dorsal recumbent position, since this position provides a good visualization of the area to be cleansed. Okay, ma'am, I need you to flex your knees, and I need you to lift your buttocks so that I can place a bedpan underneath. So I'm going to help you lift your buttocks in a count of 3 po. 1, okay, 2, 3. Okay, after doing that, I am going to wear my working gloves and then start with cleaning the perineal area of my patient. So, okay, ma'am, now I'm going to expose your genital area. So, expose only the area to be cleansed so as to help the patient avoid having chills and from getting embarrassed. After doing that, I am going to flush a warm water over my patient's perineal area. So, okay, ma'am, now I'm going to pour a warm water over your perineal area. Okay, so I was doing that. I'm also inspecting the perineal area of my patient, noting for any particular areas of swelling, inflammation, excessive discharge, and discharge suppression from the orifice and presence of others. So also I am using a warm water because warm water will soften and dissolve blood clots and also to prevent the patient from having chills. Now I am going to proceed with cleaning the perineum or cleaning the genitalia of my patient. I'm going to place my kidney basin here. This is where I'm going to discard the cotton balls using my pickup forceps. So next, I'm going to pick a cotton ball and then start cleaning the genitalia of my patient, starting from the midline, from the symphysis pubis down to the anus, and then discard. Then I'm going to pick another cotton ball and start cleaning the labia majora from the farther side and start at the mons pubis down to the anus by way of figure 7. And then discard. Then I'm going to pick another one. And then clean the labia majora of the opposite side, starting from the mons pubis down to the anus. Next, I am going to pick another one and clean the labia minora starting from the farther side of me and starting from the mons pubis by way of figure 7 down to the anus. And going to pick up another cotton ball and do the same on the other side. So after doing that, I'm going to clean the groin area of my patient. So after that, I am going to flush my patient's genital area with warm water. So okay ma'am, I'm going to pour again the warm water over your perineal area. Okay, after that, I'm going to dry my patient's genitalia using a dry cotton ball. So to do that, I'm going to pick up a cotton ball and I'm going to do the same strokes I used from the cleaning of genitalia. So I'm going to begin with the middle line from the symphysis pubis down to the anus. And then discard. Next, I'm going to get another dry cotton ball, clean the labia majora by way of figure 7 down to the anus. Discard. Then I'm going to pick another one and do the same the opposite side. Then another dry clean cotton ball for the labia minora. After that, I'm going to dry the groin area of my patient. Then discard. Then to the opposite side. So after that, I am going to take the bedpan off of my patient's buttocks. So okay ma'am, I'm going to help you lift your buttocks again so that I can take off the bedpan beneath. Okay, 1, 2, 3. After that, I'm going to turn my patient's right side so that I can also dry her butt cheeks. Oh, okay, mom, I need you to turn to your right side so that I can dry your butt cheeks. So I'm going to use another cotton ball. Then discharge and do the same to the other side. So, okay, mom, you can now lie down on your back again. And now, since we're done, I'm going to place a perineal pad on your underwear and then let you wear it. Okay, mom, now we can also spray an antiseptic as needed. And now I am place a perineal pad on the patient's underwear, since perineal pads absorb blood and discharge from the vagina. So I'm going to place the perineal pad. So after that, okay, now ma'am, we're done doing your perineal flushing. How do you feel? Are you much comfortable, and are you feeling refreshed? Okay, that's good. So now mom, since we're done, I am going to leave you now and let you have some rest. Okay, so if you need anything, please do not hesitate to use the call button so that I can go back here and attend to your needs. So thank you very much, mom. So after doing the procedure, so I'm now going to proceed to the aftercare of the equipment that I used and then document the procedure that I had just done.